For someone wondering what the difference would be in effectiveness, how would you say stem regen would compare to a stem cell therapy where you're actually extracting out of the bone marrow?
Okay. I cannot legally compare STEMREGEN to a medical treatment. So let
Mhm.
me not answer the question directly as you asked it, but let me kind of give you information
Sure.
around the topic. You get a stem cell injection, it will be normally about 100 million stem cells. You get about roughly 15% survival. So, about 15 million of these stem cells in your body are there to be effective and they do their job. They do it very well. So, stem cell injections are effective. But you will see that a typical stem cell injection, unless you do a lot of other things to support stem cell function in the body, and many clinics do that, you will see probably 30% of the people saying it was great, 30% saying, it was okay, and 30% tell you I wasted my money. We have not yet resolved the whole physiology of how we can support the role of stem cells in the body. Now, you take 2 capsules of STEMREGEN, you will release on average about 10 million of your own stem cells. So you do this, let's say 2, 3 times a day, you have released 20 to 30 million stem cells on that day. You do this every day for a month, you have released between 300 million and a billion of your own stem cells. And you can do this for long periods of time. A stem cell injection is a one-time event. So to really compare both, we're doing a study right now on congestive heart failure. It's done in Madrid and Miami. So we take patients, individuals that have been at least for 2 years with stable chronic congestive heart failure. They've had all the treatments that normally you provide to people with congestive heart failure, and they are at a place where they have an ejection fraction, which is the amount of blood ejection by the heart, of less than 45%, which is one way of diagnosing congestive heart failure. So the typical experience of that person, you take a walk for 2, 3 blocks, 1 block, oftentimes you need to stop, sit down, catch your breath. And we put them on STEMREGEN, 2 capsules 3 times a day, or we provide a stem cell injection, or third group, we do both. And so far in the study at this point, it's an ongoing study, but we've had 10 patients going through these phases, and we get within 6 months of taking STEMREGEN with this blend of plants, we get all 10 patients having normal heart function after 6 months. With stem cell injection, we get about the similar outcome, a little bit better. And if we take the combination of both, we get about twice the benefits. So, what is slowly emerging from this is that if you can afford a stem cell injection, make sure you support your own stem cell release after the stem cell injection. This is how you get the best benefit. If you cannot afford stem cell injection, just supporting the natural ability of the body to support the release of its own stem cells. So basically, we're tapping into the body's innate ability to repair. That is enough to help parts of your bodies to repair and have a significant impact on your physiology or quality of life.
Yeah, what you're talking about is something I think you're starting to see across kind of the wellness and definitely in the medical spectrum. It's this ability to provide the body with numerous different sources of something that's very beneficial. In the
Mhm.
case that I see a lot of here at our center and other centers around the world's utilizing something, let's say like NAD. NAD in an intravenous format will give you that boost. You could also do different types of format precursors or supplements. And what we've been able to see is the more areas you could get NAD into the body, the better off are the
Mhm.
results. If you do intravenous and let's say a nasal or a patch or something, you're going to get better results than just one of them alone.